all want to say that I'm just so thrilled to be here today and to be working on this guide. And we're not supposed to talk very much, and so I wanted to just frame a little bit of the discussion. And I am so, I don't know, kind of moved, I guess is the only way to express it, because this is a slide that actually, for those of us who are pretty old, helped actually initiate this work. And I wanted to go back to it. So back in the day, at PEPFAR, we realized, of course, and it was actually written into the PEPFAR legislation, that gender and gender-based violence was a really big issue, and it was something that even the original legislation of PEPFAR included as an important thing for us to address. And I had the privilege to be able to work with a very talented group of people to determine, you know, as we were just beginning to learn about these relationships and what was going on, what would be some special initiatives that we would undertake. And for me, as a clinician, I always felt as though post-rape care was just this huge missed opportunity. Here we were, the largest public health initiative in the history of the world, honestly. And we were delivering ARVs to all these clinics, and we were training all of these providers, and we had all of this capacity. Why weren't we offering post-rape care services? So we worked with a very talented group of people from Pop Council, and I don't know if any of them are still in this room, and from various other organizations. And we said, okay, let's just see what it would take to introduce post-rape care services at a community health center in a couple of districts, and see, you know, what do you need to do? How do you mobilize the community? What training? What does your logistics supply chain need? All of this stuff. And at the actual presentation of the findings, and we had about 30 clinics in Rwanda and Uganda, we had a very unexpected finding. And this chart and slide comes from that actual original presentation, and it actually kind of hit me like a sledgehammer and really, truly changed my career path. And this manual today is very much a part of that journey. So we had a very unexpected finding. And the finding was, who presents for post-rape care? And I sent this slide around the world, and I've used it ever since. And it's titled, "What's Wrong with This Picture?" Because so many things are wrong with this picture that one does not know where to begin. But if you think about this as being now probably 12 years old, at that time, none of the services were set up for children. They were all set up, if there were post-rape care services, for women of reproductive age. Nobody thought about boys, and nobody thought about kids. And then, of course, the other thing that's very wrong with this picture is, where are all the women? Like, what happens to the 18, 19, 20-year-olds who are raped, and why are they not presenting for care? And all the stigma issues that are associated with it, and people not valuing care. So I always put this slide in just to remind people of where we began, and today it's actually very moving that this is really one of the, I think, things that actually motivated the work that we're talking about today. So just a couple more points, and then as was referred to earlier, we now have very strong data, and I run a partnership called Together for Girls, which basically brings together a consortia of public, 5 UN agencies, the US government, the government of Canada, and the private sector to address the issue of violence against children, with a particular focus on sexual violence in girls. Our entry point in countries is country-owned, entirely violence against children surveys, which are nationwide household surveys, where we interview 13 to 24-year-olds on their experiences of sexual, physical, and emotional violence and the consequences of it. And what we have found, and these are all the countries that we have data on to date, is that, as noted, an estimated 1 in 3 girls and 1 in 7 boys has an unwanted sexual experience before the age of 18. We also find that there are huge consequences to this in terms of reproductive health. And we have massive decks of slides, and you can go on our website and find all of our data. But this one always hits home because about 1 in 3 girls report, who've had an unwanted sexual experience, report that they had an unintended pregnancy as a result. And you can imagine in the countries that we're working in what that means for a girl, okay? That definitely means that school is finished, period. There is no, nice little school classroom that has girls in there with their babies learning what they're gonna do. They're done. Often they have to marry their perpetrator, and the consequences are just endless, and also for their children. I missed a slide somehow, so I want to go back. Excuse me. Well, maybe I won't go back. All right, so this slide is really basically also from all of the data that we get from the VACs. And it has to do with stigma and services, and provides a very compelling programmatic direction for us that also, I don't know why.
Can you use this one instead?
Yeah, sorry, it keeps going off and on. That provides a very compelling direction for us programmatically. And that is basically that less than 50% of girls and even fewer boys ever tell anyone about their experience. So we know that disclosure can be quite therapeutic, so there's not even disclosure. And we do know for many younger people, often children don't necessarily process sexual violence even as sexual violence, or define it like that. So this is a huge piece of work that we have to do at the community level that this guide will help with in terms of actually starting the conversation and getting people to think about, what is right, what is wrong, what's normal, what isn't, and making it safe for children to actually talk about this. And then the pyramid goes down to a really very sad place, which is that basically nobody gets services. I mean, I think that's the only way you can think about it. And again, I just want to congratulate everybody in this room, because any services that kids in these countries get, probably everybody in this room had some little finger in the pie of contributing to. Because, is that better? Like that? Right here? Right there, okay.
I think that will help us.
Perfect distance.
There we go.
Anyway, because we know that it's just very difficult. And again, when we first saw that slide, the first slide that I showed you, I started kind of rabble-rousing in a very significant way about what we were going to do to get children into services. And I had long conversations with my colleagues at WHO in Geneva about what they were going to do about this. And I'm happy to report that now, what is it, Gretchen, you think 7 years, 10 years? Anyway, a very long time since then, now WHO is actually working on their technical guidelines. And their key tool that they're using to inform them is the guidelines that you guys put together from USAID as a part of PEPFAR and Together for Girls and AIDS Star and other work. So with that, I'm going to just stop, other than to say, the important thing now is how do we get the message out about it? How do we disseminate it? How do we make sure this is used? How do we make sure that people recognize that post-rape care services are critically important for women, boys, girls, children, that in fact this becomes unacceptable. There's this big debate in the community between prevention and response. I think they're, like this, you can't have one without the other, and they mutually contribute to each other in a major way. And I just want to give you a heads up. We are about, through our partners, to launch a major campaign in March that will hopefully go on for some time, called Every Hour Matters, to try to just raise awareness of the importance of post-rape care, and how everything from the short window of time that you have to prevent HIV, the 72 hours, unintended pregnancy, but also the fact that people who experience this can go on to recover and lead very healthy, terrific lives if they just have, some support through the whole experience. And again, I just want to push everybody to think younger, think younger, think younger. You know, we're missing the 10 to 15-year-olds. We're missing the boys who are raped. And we just have to realize that even in the US, you know, 11% of high school girls experience rape in high school, 11%. Okay, this is not an issue unique to developing countries. It's all around us and we have to just get it out there. So with that, I thank you very much.